Welcome, everyone. It's really nice to see some familiar faces. Thanks so much for making time to listen in and join this conversation tonight. You're going to have some homework during the call and after, so be ready, flex your knuckles. I do want to welcome you. My name is Mary Catherine Moffitt. I'm the Vice President of Policy and Advocacy at HFA, Hemophilia Federation of America. The purpose of tonight's call is to share some important updates to two critical issues that have been happening in Washington, D.C. And these are two issues that significantly impact the bleeding disorders community. Quickly, those two issues are: one, reorganization within the Department of Health and Human Services. Has left specifically the Division for Blood Disorders and Human Genomics in flux. That was the purpose of our very first organizing call together. There's a lot of uncertainty around the services that were provided through that division and where they go now. These are services that directly serve and support critical needs within the bleeding disorders community. So that remains a primary focus for us, and we want to share out what we can tonight about those updates. But number two, there is a spending bill that has been introduced and passed the U.S. House that includes a lot of stuff, but specifically a long list of changes to health insurance, to Medicaid, and to marketplace plans that you can purchase individually if you don't have insurance through an employer or you don't qualify for coverage through Medicaid or Medicare. And that bill that passed the House is going to leave 16 million more people without health insurance at all, and directly puts 11,000 or more families in the bleeding disorders community at risk for also not having health insurance coverage to access care and treatment that you need. So those are the risks, but it's not over. It's not done. So that's what we're going to talk about tonight. I mentioned earlier that you may have some homework. Here's your first task. We'd love for you to drop in the chat the state where you live. Maybe it's not the state where you are today, but please drop in the chat who you are in the state where you live. This will be helpful for building a plan and moving forward by the time we get to the end of tonight's call. So why is organizing right now really important? You may be like me and tired, or hopefully you could be like the version of me that I would like to be, which is not really sure what's going on. But our commitment is to be able to help guide our community together with national partners through this time, through this moment. So here's what we know. We know and we continue to hear from lawmakers elected to serve in Congress, in the U.S. House and the U.S. Senate, that they want and need to hear from people that they represent, specific constituent experiences, stories, examples of how something like in this current bill, how those changes would impact you in your real life. And not only now, but always, hearing from constituents, hearing from us, helps inform how elected officials do their work and cast their votes. We know that the bleeding disorders community is a small but powerful community with a lot of historical experience in advocacy, who also need access to the right doctors, treatments, and health insurance to be safe and to live well. So this is the principle on which we base our ongoing work, but also to frame up what we have to talk about tonight. So because of these two issues happening now, there's a lot at stake. Maybe not for you in particular, but for the community at large. And what I haven't laid out is that there are risks to what we learn about ways to improve treatment and care for the bleeding disorders community that are part of a lot of the unknowns in the changes that are happening in Washington right now. So please keep that in mind. Our commitment, let me tell you what it is that we're going to do. Our commitment during this call moving forward is to give you the tools that you need, that we know and hear work, and that we hear from you especially are easy for you to use so that you can continue to do what I'm doing. For example, navigating summer while kids are out of school and running in and out of this office where I'm talking to you from right now, doing my job, running errands, paying my bills, living my life, being a person in my family and a friend to the people that I love. You have big lives, hopefully. The goal, though, of engaging around these issues right now is to make sure you have everything you need to continue to do that. So it takes a little bit of work, but we're going to continue to guide you alongside partners to make this as easy as possible. So that is an invitation for you to always tell us if there's something that we're not giving you that you need. All of those tools that we're providing for you through our intention to support is so that you have what you need to speak up. So the last time we met, the House was voting on that bill that I mentioned that would make health insurance through Medicaid and state marketplace harder for fewer people to get, more expensive to buy with less time to shop. It would add lots of extra work and make it easier to drop eligible people, people who qualify and are doing all the things they need to access those types of coverage. And what is most worrisome is what are your choices? And the people that are likely going to be impacted the hardest will have the least options to do something alternatively. So what happens next? This bill is going to the Senate. It's technically in the Senate's hands now. Our job is to sort of live in the details and follow what's happening. And there's not a clear path. But what we know is the Senate, together with the House leadership and our president, would like to see the Senate vote on this bill as early as the end of this month before the July 4th holiday. So I want to dig in to all that we have to cover today. Usually, this is the time where I pivot and open the floor for all of our critical national partners to be able to share updates on these two big things. And with your permission, now live on this call, I'd like to ask you to hold. And we're going to hear from a special guest and then continue through some of the action planning that we can do to speak up now and contact our US senators, and then close out our call with all the necessary details and information and considerations that you can get in order to choose and pick what it is you're going to do to speak up, so long as you do. So, with all of that, I would like for you to help me welcome a very special guest who is going to talk to us specifically about our effort right now to reach out to our US senators, specifically through their district office. And this is why. The US Senate keeps offices in DC, of course. If you enjoy going on advocacy days and lobby days, either for the bleeding disorders community, the rare disease community, or others, you know that those offices are a really important place to be able to have conversations and share your story. But that's not the only place. And you've seen in our work that we've been talking about making in-district meetings. In-district for the Senate is the entire state. Two people are responsible for representing everyone in their state. And we happen to know someone who does this work for a living, who's also a great friend of the community. So I'd like to introduce Carson Alouette. Carson is the Senior Outreach Director for Minnesota's Senator Tina Smith. And he's going to give us some behind the curtain intel. And hopefully, if you have questions, you can drop them in the chat. Carson also has a very important program to go to for his daughter. So he'll only be with us for a few minutes. Carson, with that, take it away.
Thank you so much, Mary Catherine. As many of you know, I'm Carson Ouellette. I'm based in Minnesota, just on the border with Fargo, North Dakota, and my wife Emily runs the Bleeding Disorders Alliance of North Dakota. And today I want to give a few brief updates about and maybe some background about what the difference is between the state staff and the folks you may have met if you've ever traveled to DC for advocacy efforts, talking to our counterparts in DC. In my portfolio for the senator, I cover agriculture and childcare issues. So I'm not hands on directly in healthcare following or working on that issue, but it's definitely applicable to both. And one of the key considerations that we as outreach staff in the state have is that we need to keep the senator informed on what people are saying, thinking, and wanting from her here in the state. And of course, people go to DC, but we like to try to go out to them and in the state when they can't make it out to DC. So we try to work on an equity basis of getting out into communities that don't have the time and funding to get out for lobbying and advocacy on the Hill. So we also plan the senator's events in the state as well. So that is something to consider, that we have this scheduling remit in our jobs that we need to help manage what her time is when she is back in the state. So I can give you a bit of things that I like to see from folks that I think makes them more pleasant meetings and more interesting and more beneficial to both sides, where they feel heard from us and also they're uh, conveying information as effectively as possible. And just for reference, our main office is in St. Paul, Minnesota, and even though I cover a full statewide portfolio, I am not based there. So that's why sometimes dropping in to a state office is a little more difficult. We're not all centralized the same way that we are in DC, and folks are working in DC in person more because of hearings and things like that that are more in person than what we're doing. I'm often traveling throughout the state a lot as well. So whenever you're meeting with someone, and I know this is the case in DC as well, is you don't want to bring personal politics or talking points from cable news to the conversation. That keeping the conversation directly tied to the issue at hand is absolutely critical, and that you go in understanding that this is a person too, that they are not just an AI bot that is waiting for your, or an answering machine or a voicemail that's waiting for your feedback, that they can convey it, but also you're building a relationship and it's longer term. Uh, the roles in DC are very high pressure, and so their turnover is a little higher than in the state offices, because we do have these breaks where the senators in DC and we're not um, you know, on call as much as they are when she's back in the state for us. So staff stick around a little bit longer here in the state offices. So you have a longer term, maybe the whole 6 year Senate term, to build a relationship with someone and get to know them. And generally, we are split up into issue areas. So when you're calling or talking to an office and you first get a phone call or someone to answer your phone call at the front desk, it's good to ask them, please direct me to, or can I get in contact with the person who handles healthcare in this case. In my case, someone calling for agriculture would want to reach me because I'm the one who can take their concerns and speak a little more knowledgeably than just the basic front desk takedown, more stenographer role. So making sure you're talking to the right person is very important. And then you can always find areas of agreement, no matter what the member themselves may have just said on any cable news network or what you would know of them from the press. There's a lot of room or space between those comments and those public things put out for the press and what the staff themselves or even what the member that believes. And there's a lot of room that you can find agreement, even if you feel that maybe you're walking into a more icy situation where someone is not particularly fond of or maybe necessarily on your side on an issue. So trying to find those areas of agreement is very important. So if you've done any DC advocacy in the past and you have connections with those legislative assistants, just dropping another line, even if you've talked to them recently, just dropping a line and say, hey, can you connect me with your counterpart in the state? I find that there's very few organizations that are savvy enough, but there are a handful in the state, in Minnesota, agriculture realm, who are doing the two-pronged approach and trying to connect on the state, taking a conversation in DC and saying, "This was great. Now, how can I connect with your counterpart in DC so we can continue this conversation with that person, or when the senator's back in the state?" So that's where that opening for some more FaceTime as well from staff and the senator themselves is important. I have a bit more time because generally I might be traveling many hours to get to an event or a meeting. I don't want it to be a 15-minute or even 30-minute conversation. I want to get a little more out of it. If we're making that kind of effort, or if a person's traveling to see me. Whereas in DC, I know my counterparts have 8 meetings in a day, interspersed with hearings and memos that they need to write. So if you've ever been in a meeting uh, at the Hill, it might feel a bit rushed, and they might feel a little anxious. That's because they have a lot on their plate, and it is an intense work day that they have during sessions and fly-ins. Say in March, when Washington Days tends to happen, there's a lot of folks coming out to the Hill. So it's just there's a little bit more room to breathe, a little more room to, like I said, build that relationship, and that is why I think if you're missing that opportunity, or you're thinking that, maybe it was an icy reception from the folks in DC, I'm not going to bother with the state staff. I think that's a missed opportunity, because you don't know where you could find a really friendly person, or a key ally who comes to you, not necessarily to say, well, my boss changed their mind, but saying, hey, my boss had a question, and it made me think of you. So can you fill me in more on what you said earlier, or how it might relate to this? So that's kind of um, the approach that I think folks can take by doing that two-pronged and making the effort here in the state offices. So I have a little bit of time for some questions, but otherwise, that's the details I have.
Carson, I took some notes and dropped them into the chat. We also always save the chat because it's helpful to look back on. Any questions for Carson? I think one of the most important things I heard you say is that when you set up a meeting in the district, you have the chance to have a longer conversation, perhaps a deeper conversation. Um, and I heard you say also that, I think you said this, to cheat. We've already spoken once today, but I think you said that, what's really important about taking time out of your day to advocate for the bleeding disorders community is not a one and done. It's building a long relationship, so that you can truly work together to understand and move forward solutions to problems. And in the district, being able to use those longer meetings and more time together gives you the chance to achieve that.
Yeah, I would say part of that relationship building is on the staff side, is we're building a roster of folks to then collect information and feedback from. So even if, say, you have a conversation about this specific bill, but then 6 months from now there's a 340B issue, and maybe because of whatever, that staffer knows that, oh yeah, bleeding disorders, 340B, there's kind of a connection there. I should go back and ask that person that I talked to months ago what they think about this. So there's that building that relationship that goes beyond even the current legislation.
Just want to
Any
say
other
thank
questions or
you. I
advice?
was just going to say thank you. Thanks for being here, Carson. I'm friends with your spouse on Facebook, so I get to see your little girl. And I hope you have a fun event tonight.
Carson, we do have a question in the chat. How often do you recommend communicating with your in-district person?
Yeah, there's certainly, I think it's kind of like any interpersonal relationship. If you're starting to get s- ignored, maybe it's time to back off a little bit until there's something like uh, until there's something that's absolutely necessary. But if people are just sending me updates, that I never feel flooded or overwhelmed or anything like that, when it's just hey, we want to see this happen, or we don't want to see that happen with legislation. That's all just important updates. But if you're talking checking in with a over coffee or something like that, a couple times a year would be good, if there's not super pressing legislation at hand.
Terrific. This is really helpful. You only have 8 minutes, so I know you need to get where you're going. Thank
Yeah.
you so much for sharing some of this precious time with us.
Have a good night. Thank you.
Okay, great. I'm just editing my notes. So I think this is where, forgive me, I'm getting on track. Okay. So I mentioned before there's two things happening. So I thought I would just give you a deeper dive, and Ray can drop into the chat the notes printed out here so you can save them and refer to them later if you'd like. So, what's happening in Congress right now? Um, so, where to begin? So, I mentioned earlier that there is a spending bill. It is named the Big Beautiful Bill Act. If you follow the news, you've seen a lot of talk about this bill for the past couple of months. We've been mobilizing advocates to speak up and speak out against the healthcare cuts that were included in the Big Beautiful Bill Act. It is H.R. 1. Great question, Brittany, and thanks for adding that in the chat, Ray. Um, I mentioned that the timeline, which is always a question, what if you're going on vacation? You want to take action, but you don't have a lot of time right now. What we know right now is that a vote could come to the Senate floor in a perfect world before the July 4th recess, which could be as early as let's see, the 4th is a Friday, so like through the weekend into Monday night up to, June 30th, July 1st, July 2nd. We don't know the answer to that. And so, what we ask of you in considering a timeline to take action and do something about it, and doing something can be going to your district office to contact your US senators, but also sharing it with other people who share a passion for this issue and who potentially would be at risk and have something to say for the cuts that are proposed in access to health care. So the second item that I want to talk about is equally ambiguous. It's what people say about this bill versus what's in writing. Also, if you're following the news, Carson talked about, not bringing sort of cable news talking points into a meeting. That's our job, is to give you the information that you need in order to be a strong advocate who also feels confident in what it is you're talking about. Our commitment as a nonprofit organization is to always do our work in a nonpartisan way and to look for solutions and policy that are bipartisan, because partisanship has nothing to do with living with a bleeding disorder. That being said, we also understand and work alongside people who understand the machine of how things work and how bills get passed in Congress and in state houses too. So a lot of people are talking about these laws, this bill, you know, doesn't impact Medicaid and it doesn't reduce Medicaid coverage. The way the bill is written produces results that will cause people to lose coverage. People who are still qualified but don't meet the increasing requirements in order to maintain coverage and or qualify for coverage from the start compared to how people would qualify for coverage right now. And that's true for people who buy health insurance through a marketplace plan and people who are income eligible for Medicaid because they don't make enough money or receive insurance benefits through an employer, or make enough money to buy insurance on their own. So what we know is that the Congressional Budget Office looks at bills to determine how much they'll cost or save the government and also any other measurable impact on a bill. And what we know from the Congressional Budget Office, based on the House's past One Big Beautiful Bill Act, is that there will be less spending on healthcare in the provisions of healthcare related in the bill, number one. And number two, that those provisions will produce an outcome that includes 16 million fewer people with insurance or 16 million more uninsured people. And what we know in looking at the data about people in America, in the United States, living with a bleeding disorder is based on how many people rely on Medicaid for healthcare coverage on estimates and or rely on marketplace coverage and or have a bleeding disorder or are being treated but aren't diagnosed or in the data, it's anywhere from 11,000 to 16,000 families. That's back of the napkin math. That's not published anywhere, but we've definitely put pen to paper alongside our national partners to say at least 11,000 families are going to be impacted by these outcomes. And that's in the bill as it's been passed in the House. So, um, what I don't know that I mentioned earlier is that this bill passing the House and now going to the Senate gives the Senate the chance to either pass it similarly with no changes or make changes that could potentially impact protections needed in the bleeding disorders community to be able to access and afford and maintain healthcare coverage that is the ticket to getting to see your doctor and the ticket to getting the treatment that you need 12 months a year for the duration of your life, in most cases. So that's the circumstance with how healthcare is impacted specifically in this bill. And that talking about how this bill doesn't reduce Medicaid is the difference of what's said and actually what's written. So I'm not following along the chat, but thank you in advance for if you're dropping some of these talking points into the chat. That's a thank you to my team. If you haven't already done that, just drop that in there. So, the only last thing I'll cover, and then I want to talk about what does all this mean for the bleeding disorders community specifically, is that there's also elements of a lot of red tape. So that means a lot of reporting requirements, sometimes more than once a year, and also for renewals. So auto renewals aren't a thing in this proposal. Shorter timelines in order to produce the paperwork needed, additional documentation required in order to be deemed eligible after you meet other basic eligibility requirements. A loss in time to shop for ACA plans. And in particular, right now, if you buy an ACA plan, you can make up to what is called 400 times the federal poverty level. So the federal poverty level is a measurement set at the federal by the federal government that determines a baseline, and that's how programs such as Medicaid or CHIP, Children's Health Insurance Plan, are based on for eligibility. You can use the link in the chat to say, based on what my family's income is, where do we fall in the federal poverty level guidelines? It's rated by number of people in your family or your household. And so during COVID, the premium tax credit that's part of the Affordable Care Act to allow people buying health insurance on the marketplace to get a tax credit that would make it affordable to go ahead and pay those premiums and enroll. That tax credit became enhanced in a number of ways. And primarily, it became enhanced by allowing more people who make more money but still don't have access to employer provided coverage or would otherwise not be able to afford buying coverage outright. More people based on their income up to 400% could buy insurance and receive a tax credit. There are a number of other components to that enhancement, that making this tax credit better for more people to make sure they have health insurance. And I'll tell you, in our works, there are strange bedfellows at times, and the people that like these enhancements a lot are insurers or payers because so many more people became members of plans to have health insurance. And so, being able to ask Congress to continue those enhancements was one of our top priorities at the end of last Congress into this Congress. And now none of those tax credits, which cost the government money to be able to close that gap, are included in this big beautiful bill. So we know that based on just the cost of things in the market, cost of healthcare coverage, especially in marketplace plans, is already expected to increase significantly. You're going to have to pay more for your plan next year, but you're not going to be able to draw down any of the tax credits that allow you to pay that premium in order to get coverage and then go fulfill an appointment or fill your factor, for example. So, those are some things specific to the ACA that are really concerning, and the reason why we're talking about 11,000 families or more with bleeding disorders who aren't going to be able to get or keep Medicaid, not going to be able to buy health insurance, don't have health insurance through an employer, but still need factor for themselves or their family year round. And how are they going to do that? So, with that being said, there's some other really important considerations that we wanted to be sure we brought to your attention. So I'm going to pass it to my colleague Mark now to talk a little bit about that. Mark, how does this impact the bleeding disorders community?
Yeah, thank you, Mary Catherine. Yeah, so as we've heard, the Mary Catherine's kind of covered a lot of it already, but it does bear repeating that a lot of these cuts, or a lot of the bill really does directly impact the bleeding disorders. Again, I'm probably going to repeat a lot of things. It's in the chat as well, but just kind of saying it out loud. You've said it before. Within bleeding disorders, we're seeing about 11 to 16,000 families, or bleeding disorder patients' families potentially lose coverage. With those tax credits expiring, again, that makes it much more difficult to pay for insurance, income levels. A lot of things we took for granted before in the bleeding disorder community are going away, which makes overall access to medications, to care, a lot more difficult. And just if we're thinking about sort of our more special, like more kind of focused communities, one thing we didn't touch on, but it is in the chat. We think about our rural communities. I think I see a couple people here in the chat who would kind of fall under that umbrella. We see rural hospitals and care could be lost because of lost state funding. This legislation cuts a lot of funding that states use for their hospital systems, and we've seen many rural hospitals already close to closing, even leading into it. People of color and impoverished communities are going to be hit the hardest. People who don't have the time or resources to follow the new rules, to stay on top of all the paperwork, to stay on track of everything. They're going to, we anticipate a lot of missed deadlines, or just not being knowledgeable about any of the changes, which will lead to a loss of coverage and care, and access. So, with that, again, a lot of these points Mary Catherine said a couple of times. We heard, they're in the chat as well, so feel free to copy those and save them on your own. I think, where I'm going to take on now is kind of where do you come in as a community? And this is where we're going to kind of talk about. Well, Carson, Dave, gratefully gave us some insights into about what is it, visiting your local in-district office. So we're going to walk you through that, how to locate your in-district Senate office. So I'm going to be talking. Ray will be kind of controlling the screen, but we're going to show you exactly how to find your U.S. senator, so we can do the drop-ins ideally before July 4th. So if you're on Senate.gov, you see this page, and if you can right now, just if you're able to, just save Senate.gov in your favorite, in your bookmarks, and then you can just follow along later. So it may make it very easy, which is very good. And I will say, I will just do a quick disclaimer. We know that reaching out to district offices, making these visits is not normal is not a regular part of your lives. And I'll be truthful with you guys, it's not for me either. And I am part of this team. Just a quick little funny story. So when we did the first run through of this last week, and we kind of played around with it, I found my state senator, which is different from my U.S. senator. And I mistakenly said, oh, I think I found it. And Ray had to be like, no, that's your state senator, not your U.S. federal senator. Those are two very different things. So I was like, okay. And then today we did another run through earlier today, and I tried to do it again. I found somebody different, but this person was the House representative, not the U.S. state. So I say that in full disclosure to, again, even if it seems like it's very easy for us to say these things, to say just go out there, because we have access to everything. For even people on HFA staff, this is still something we're all learning, but we're committed to showing you how to do it, to doing it ourselves. Talk a little more about that later about what HFA is doing internally for our part for this. But going into it, so you see the website where Ray is on. So Ray, thank you. So you go to choose a state. We're going to start with, so I'm from California. I'm in the Bay Area, San Francisco. So we click on that drop-down menu, go to California. Okay. So we see these two senators, Alex Padilla and Adam Schiff. So you can click on their name or their picture, and that should take you to their website. There we go. So all you need to do is, if you'd like to, just kind of scroll all the way down, go to their website. If you go to contact, there we go, office. Sometimes it's right smack there in the very forefront. So this one's very easy. So then you'll see that they have a couple of offices across the state. So San Francisco, Fresno, San Diego, they have a little map of showing places where they are. So for me, because I live in the San Francisco Bay Area, I'm going to go down to Los Angeles. No kidding. I'm going to San Francisco because that's only, a 20-minute drive for me. But we understand that a lot of these places are not convenient. So we're only asking if you're able and it's feasible, your schedule allows, to be able to make like a drop-in visit. We have all the materials. We do have some best practices. A couple of things, just as Carson mentioned before, or if you did, call them first to make sure, call those numbers they provide to make sure that somebody will be there first. And, if not, just email them as well, a list of the points that you'd like to talk about. Just so they know, just so you're prepping them, and also just checking if they do accept drop-ins, because we don't want you to drive like an hour or more to just come to to come to an office with closed doors. And if you go to Alex Padilla, Ray, really quickly, just to show the full spectrum, it's the same thing. Just it's same concept. We recommend so we found that the senators don't necessarily share the same offices. They may have offices in the same cities, same towns, but not in the same buildings. So just take a look at both. If you can do even just one, that's great. If you could do both, that would be fantastic. Again, we understand that for some traveling is difficult. It's not feasible because a senator may only have an office in the middle of the state, which is 6 hours away. So we just want you to take a look at this and just kind of see what works for you. And we want to do one more example. So Ray, if you want to go back and select Pennsylvania very quickly. There we go. There we go. So we have John Fetterman and David McCormick. And same thing, just kind of quickly walk through both. You kind of scroll down, the beautiful city of Pittsburgh. I recognize that bridge, I believe. So sometimes it's a little more scrolling. Oh, awesome, Donovan. So John Fetterman has a number of offices around, across the state of Pennsylvania. So again, you just take a look and see which is closest to you. We obviously do a drop-in, so there's all those options depending on where you are. And then Ray, David McCormick, just to finish that out, and I will highlight something in a second. Let's scroll down. Yeah, same thing. So the same as John Fetterman's. You have to scroll down a little bit more, but there's are the offices. He actually has a couple more than John Fetterman, which can be convenient for some. So that's generally so this website is the best for finding your U.S. senators. Again, there's only 2 of them, and that cover the whole state. So we just want to make sure you're looking at the U.S. or federal senators, not the state senators. Sorry, Ray, I apologize. So I don't know if you guys caught it in Pennsylvania that Fetterman is a Democrat and McCormick is a Republican. And like Carson said before, you know, it's not the time to bring in your, the political news or the Fox News or the NBC, any news from the news stations. It's not this time to align. If you're a Democrat, going just to Fetterman's office, we're really just this bleeding disorder care is a nonpartisan issue. All we're doing is making sure that each senator is educated on what the needs are for the bleeding disorder community. So if you can, we highly encourage you to go to whichever is closer, regardless of whether you're aligned to their side. So that's just one thing I did want to highlight. So that we really encourage you to go to both of your senators if you can, and just again spread awareness of what the needs of the bleeding disorder community are. And with that, I will pass it back to Ray to talk about the resources we have available for you to do that.
Thank you, Mark. I really appreciate that. And one of the things that I think, just to sort of put a bow on what Mark was saying, is in some cases it may be beneficial to call ahead, even if you're doing a drop in. As Mark had said, in some cases, your local the closest in-district Senate office may be an hour away. Would hate for you to drive an hour to find that nobody is in that office, because these offices are not, hugely set. You may have one person or three people. So it's not a bad idea, if you're driving any sort of distance, to call ahead to make sure somebody's there. Because what we don't want to have happen is for you to drive an hour and a half just to slide a piece of paper under the door. That is a waste of your time and energy. So in those cases, it may be beneficial to call ahead. Now, if you are 10 minutes from the in-district office, you can just pop in, right? Not the biggest deal. So again, play that one by ear based on your proximity to those local offices. And what I want to sort of say a little bit about here, is the most recent resource that we have that we have created at HFA for you all to utilize, particularly between now and the July 4th recess, when we know the Senate is going to be considering and voting on and discussing the HR1, that one big beautiful bill. We've got this playbook. I've dropped the link in the chat for folks, just to say a little bit about it very quickly. What you'll find in there, along with all of the links that we have been dropping into the chat, you'll find all of that. But just a little bit more information about, what is a drop-by visit? What does it mean? Why these visits matter, as Carson alluded to, that, we know congressional offices track every constituent interaction. These in-person visits, even drop-bys, really do, signal that folks back home, really care deeply about the issues. It also helps to keep pressure on lawmakers, while they're home for recess. The playbook also includes some key message talking points. So, things about how cuts to Medicaid would harm people with chronic and rare conditions. Bleeding disorders patients rely on Medicaid for access to care, treatment, home nursing, these sorts of things. And the major message, the key message, I should say, is that, we're asking them to protect Medicaid. That means no cuts, no caps, and no changes that restrict access. The playbook also goes through sort of what to bring. There's the drop by visit, leave behind. talks a little bit about sharing your personal story or a message from, your family, or even, your state chapter, that sort of thing. Then, of course, how to conduct the visit. Again, Carson and Mark already spoke about this already, but it's, being polite, concise, friendly, all of these things, building a relationship with those individuals in that district office. So when issues arise or questions come up, that you can serve as a resource to them, and therefore as a resource to the bleeding disorders community, really. Um, we always, of course, want you to, following the visit or during the visit, take a photo. You may not be able to take a photo inside the office, but a quick selfie with the nameplate behind you is really enough. There are some social media messages, some sample messages in the playbook that you can use, sort of thanking whomever you met with, or just saying dropping by, leaving some information about, why healthcare is critical to the bleeding disorders community, that sort of thing. And then, of course, also talk a little bit about the report back form. We do ask that every time you go and conduct an HFA requested advocacy action, that you fill out that report back form so that we can sort of track the impact that we're having. It also leaves a space if there are any questions that came up that maybe you didn't know the answers to, that we could then follow up with the office with those answers. So um, those are some of the major things. We also want to add that, support is available, right? We'd like to, maybe, offer to pair people up, to help coordinate group visits if we can do that. All of that. We've got the Office Finder tool there for you. And just know that we're here to help. If somebody, I'm in North Carolina. If folks in North Carolina want to go and visit, either Senator Tillis's office or Senator Budd's office, reach out to me. I'd love to join you. And if that maybe helps take some of the anxiety away, even better. I'll even buy you a cup of coffee afterwards, maybe even lunch. We'll see. But anyway, just wanted to offer that up. And we've got other staff throughout the country. Like, hey Ray, I'm in this state. Do you have staff who's close by? Yeah, it's something I could look into for you. Or at the very least, again, try and hook you up with somebody else. Because I know there's power in numbers. So. But with that, I'm gonna close my mouth, and I want to turn it back over to Mary Catherine to make sure that I'm keeping us on track. Thank
Right.
you.
So this is where I would really like to hear from our colleagues who are joining this call to report out on their intel and other action opportunities. While I do that, Ray, I think that you're better at chewing gum and walking at the same time than I am. But will you please drop the leave behind? We created a printer-friendly leave behind entitled Healthcare is Critical for Bleeding Disorders. And that is the document that you can print out and share when you do drop-bys, and or if you get a meeting. You can also follow up and attach that as email. Ray should be able to drop that right there. It is in the chat. Okay, great. I see you, Nathan Schaefer. Thank you, NBDF, for being on. Why don't you get us started with some report outs?
Sure, happy to. Thanks everybody for taking the time to be on and hear the updates. I will reiterate what was explained earlier on the call, and that is that our advocacy focus right now is squarely on the Senate. Now that the House has passed one big beautiful bill, the Senate does intend to take a vote on it. in advance of the 4th of July recess. So there are a number of opportunities that are coming up, and I'll just mention a couple of them. One is there is a letter going to Senate leadership outlining our concerns and our reactions to the House bill, and that is going in coalition with HFA, the Hemophilia Alliance, a number of Athen. I think the Sue, I'm thinking of the Hemophilia Treatment Center Network. I understand there's
Yeah,
a tomorrow that you're voting on, right?
right.
So,
We're it's looking positive.
okay. So we're just waiting on y'all and then hope for hemophilia. And then I think it will be all hands on deck for this letter. And we can get you all a copy of that as soon as it is issued. Like I said, the deadline for that is tomorrow. In addition to that, NBDF will be issuing a action alert with talking points and suggested messaging for how to contact your respective senator. We envision that'll be out either tomorrow or Friday. It'll be before the end of the week. It'll be really consistent with what you've already heard on the call tonight. No cuts to healthcare. These programs are vital for everybody within the bleeding disorders community. So you can expect an action alert from NBDF if you're on our listserv. And if you don't think you are, please shoot your email into the chat and I'll make sure you get added to that. If you come to Washington Days, rest assured you're going to get that message. And then finally, there is a opportunity to submit testimony to the Senate Appropriations Committees on the CDC and HRSA programs and the reductions in force and the way that those programs are structured. And the deadline to submit those comments is this Friday, June 13th. So we have done that at NBDF. I assume HFA is doing the same. I'm happy to share a copy with anybody that is interested. But those are some updates on our end. But just wanted to say everything that's been outlined tonight with our colleagues at HFA, NBDF is on board with. We are sharing the same message about no healthcare cuts. These programs are vital for our community. So you can expect the action alert very soon. I'm happy to take any questions, but I know we're running short on time.
That's great. Why don't we pivot and hear from the US HTC network? I know that Mary Diaz is on the call today alongside Sue Lurch. Mary, are you with us?
Yes, ma'am.
Would you like to share anything?
I am very honored to be part of the team as well as being part of the hemophilia community. And as more as I'm going and learning, I see the love and the strive that our team is given out not only to our patient but to all the physician, all the doctors and nurses, um, and I'm grateful. Thank you so much for allowing me to be part of this amazing group of individuals, and as well as getting more information because I'm excited to reach out to my senators and make a difference because not only would it just not impact our patient, but it also impact everyone. And with that being said, on the behalf of the bleeding disorder community across the country, we just want to continue to support and protecting the strength of the Medicaid and the ACA. And this program not only is like the safety net of the lifeline of the individual living with hemophilia, von Willebrand disease, and the rare clotting disease, it also ensures that the life-saving treatment with the Hemophilia Treatment Center nationwide. So with that being said, as learning more about it, I just request that, I can provide important important things to everyone in the senators to protect Medicaid funding and to oppose to any proposal within the program that will be any caps as well as cut programs. and also to preserve the ACA protection of people and support the policy strain within our HTCs that to provide an expert to patients that can find elsewhere. I was reading one of articles while I was trying to learn, and there was a case study with Ethan. He was a 7-year-old boy, and he lived in a rural Texas with severe hemophilia A. And with Medicaid, he was able to, his treatment was $300,000. And with him using Medicaid, he was able to get all the things he needed for his treatment. So I'm
Mm.
so grateful. Sorry.
This is great. I'm taking notes, Mary.
Yes. So just
Don't
I'm
miss a chance to
saying,
write.
I'm grateful that, that everything that we're doing and providing us assistance so we can, make a difference for everybody and as well as, our team. And thank you. Thank you for everything.
Thank you so much, Mary. I don't know if Justine's on the call, but and I didn't name all of the national organizations in the bleeding disorder space who have been deeply engaged together in signing on the letter that Nathan talked about, being able to submit custody testimony. Athen is a core part of this group, but I don't know that Justine Kaplan representing Athen is on. So I'm just going to wait
I think
for
they
someone
are.
from Athen to come off.
Mary Catherine, this is Sue. Can I just add a little bit as far as
Yeah, that would be great.
from the USHTC, and I know that Susan Lattimore is on as well,
Oh,
who
good. Hi,
provided an
Susan.
update. The thing that I wanted to share is that most of us have gotten really good news in that we have received our continuing notice of award. So we're in good shape right now as far as MCHB. So very good news for the treatment centers. And then I know that there was discussion about CDC, and I know that that's still, from what we understand, potentially will be included with the new AHA. So who knows what it'll be called? Who knows if that'll actually happen? But so far we're grateful because we've gotten good news today. And that was
That's huge. That means that the network of HTCs across the country have received the notice of award for
not,
the funding that's needed to keep the doors open.
I don't know that everyone has received it yet, but I do
Okay.
know that at least, I
5.
believe 5 of us have.
Yes.
At least 5, and
Yes.
HPCC also. And so that's all good news, and it seems to be rolling out according to our number. We all have numbers. So we're all breathing a sigh of relief. And I know that's not what we were talking about in relation to the bill, but it's just thank goodness this has
Mm-hmm.
happened. So anyway, just wanted to be able to share that. And I know that through the USHTC, and I know for myself and as our regional director for the Great Lakes region, and my colleagues who are on, Mary and Susan, we are suggesting, if our HTCs are willing, that people do the same outreach to their personal legislators in relation
Thank you.
to the necessity of Medicaid, et cetera, for our patients. So just wanted to add that because I'm like thrilled that we got that notification today.
Thank you for that update, Sue. This is critical for where people get care. The Coalition for Heme B, do you have any notes or updates to share? Jim Romano was going to be on, and they have a new colleague that's joined them that I've had the pleasure to talk with, Lee Hall, and I don't see that either of them are on. Speak up if I have it wrong.
I don't, they're not on. I work with them occasionally, and I'm very aware that Kim
Thanks,
Phelan
Stephen.
has been pushing very hard to get the message out. And I say, look it up. You can check it on Facebook.
Wonderful. Wonderful. So Coalition for Heme B using social media to be able to get the word out about how to speak up, how to take action, and where to do it, and likely very similar and aligned with the messaging that we've shared here today. So I just want to acknowledge for the sake of this call and for all of those who are listening to it and recording, this will be shared out tomorrow by email to our contact list at HFA as well as on our social media at Hemophilia Fed on all platforms. But a special appreciation to all of the national groups that spoke and shared updates today: the Hemophilia Alliance, Hope for Hemophilia, Von Willebrand Connects, Chess, Foundation for Women and Girls. I believe I've forgotten someone and I apologize. This is the closest thing to an acceptance speech I'll probably ever make. But it comes from a place of appreciation and thanks. We said at the top of this call that we would help you build a plan. We've talked about what works. We've given you insider scoop. We've walked through at least a screen share on how to find who you're meeting with. And we've even shared some anecdotes. It's okay to make mistakes. The thing that I want to leave you with as we disconnect is that the most important thing you do when you speak to lawmakers as an advocate is be yourself. Don't change how you talk about your experience. In fact, sometimes you can think about if you were going to an elementary school to talk about life with bleeding disorder, that's a good place to begin. Keep it simple, because what the takeaway needs to be is how critical access to your care, to your coverage, to your treatment, to your doctor, to your factor for yourself and your family, and giving examples of what you do if you lose that access. What happens if you don't have the insurance that you need in order to go fill another script? Do you wait for a couple of months and those couple of months turn into a year and so on? Sometimes, yeah, that's how it works. And at what risk? And is that what you should be doing to keep yourself safe and well? This is the power of our community, and I can't wait to hear from you. There's a report back form. This is really important. This is how we know and share with our national partners that meetings are happening and feedback's being shared from staffers. The report back form is on our website, and it's in this chat, and it's in every email that we send. And our friend Ray Reardon on this call is the king of report back forms. So he's your guy. Advocacy at hemophiliafed.org is a place where you can send any or all questions, even if it's someone that you meet in the grocery store and you say, you can go with me, reach out to HFA and they'll get you connected. We can't wait to hear from you. Ray, with that, I'm going to adjourn our call and appreciate everyone's time.
Thank you,
Bye.
everyone.